It was my junior year that I really started feeling different. It became pretty obvious that the condition I had was starting to very much impact my life on a physical level. Felt this total loss of energy all the time, and I wasn't able to focus as well anymore. I didn't get to graduate from the University of Richmond because I had to withdraw. I knew that it would eventually be an inevitability that I would have to get a kidney transplant, but it didn't become a reality until I started dialysis and I was put on a transplant list here at Northwestern Memorial Hospital.
The program here at Northwestern Medicine has really been a leader in the field. Our program has really focused on living donation, and it takes a lot of coordinated effort from a large team to be able to do that.
We provide access to certain therapies that aren't available at other transplant centers. We are a destination transplant program where people come from not only around the country but around the world for our expertise in transplant care. We also participate in our national kidney pair donor exchange program. People worry about blood type matching, and being closely related genetically is not important. As long as someone is healthy and properly motivated to donate to an individual, that will result in a transplant that is going to work extremely well.
So the qualifications to be a donor, I always say, are healthy and willing. A lot of our evaluation is to make sure that someone is very healthy at the moment, but also, as far as we can see into the future, they don't have an excess risk of kidney disease or other problems.
It was hard knowing that my boyfriend, who was sick, was back home. I knew we were the same blood type because we used to donate blood together in high school, but he never asked me to donate. He kind of tried to steer me away from it, but at this point, some of his family members had been ruled out as possible donors. I sort of felt like we were stuck. I submitted my questionnaire to be a living donor. I had so many questions.
I think education is really important. Helping people have that conversation is part of what we do here, to get them comfortable asking for a gift of donation.
Being a donor is safe, it's very effective, it's the best form of kidney replacement therapy for a recipient, and I've seen the tremendous impact that a transplant can make.
We keep tabs on them along the way and make sure they're still eligible for a transplant. We sometimes have them come back and visit us periodically, and waiting for that day and that awesome phone call where we get to bring them in and give them their transplant.
I had just finished class and I got a phone call and they told me we were a match. I think I hung up, I cried, and then I called him.
I was in disbelief that somebody would be willing to do something so selfless.
Getting people through a transplant is a long and complicated process, and seeing them do well through that is obviously very important.
I don't think I have ever had nurses as nice as the ones I had here at Northwestern Memorial Hospital. The doctors, right from the get-go, they were very, very helpful. The Hispanic transplant team they have is one of the best resources for Hispanic people. They just went above and beyond.
At Northwestern Memorial Hospital, we have pioneered that, particularly in the Hispanic population, in trying to develop a culturally sensitive program to educate people about the importance of living donor transplantation. For me as a healthcare professional here at Northwestern Memorial Hospital, that's what makes me want to get up in the morning and keeps me going, the impact that we can make on people's lives.
The experience we've gained over the years of being one of the biggest living donor kidney transplant programs in the country, really, we hope to pass that experience on to our patients with excellent outcomes and increased opportunities that they may not have other places.
Now, thankfully, I'm pursuing my bachelor's in chemistry, so this is definitely my second chance.